everyone. Thanks for joining me here on Mom Squad. I'm Maureen Kyle. I want to start by wishing all of you a very happy Mother's Day. Being a mom is one of the hardest jobs in the world, and I hope all of you out there are being honored and thanked by your families. And I know certain relationships can be complicated. So a little later in our show, we are going to talk to Dr. Jackie Del Rosario about how to navigate messy Mother's Day issues. But first, we are typically so busy taking care of everyone else, our health gets put on the back burner. Research shows women who are past childbearing years are more likely to miss screenings. 80% of women over the age of 55 have one chronic illness. And research regarding women's health only is now getting the attention it deserves. I got a chance to sit down with Maria Shriver, journalist and health advocate, to talk about a new clinic that she helped push for and the need to focus on women's health.
So I partnered with the Cleveland Clinic several years ago with the Women's Alzheimer's Prevention Center in Las Vegas, and the goal there was to see, did that work? Would women be interested in the prevention model? Would they be interested in their brain health? Would they want to do what was necessary to try to prevent Alzheimer's? And over that time, I started talking to the Cleveland Clinic about we really needed a comprehensive women's health center where women of all ages could come and feel seen, feel valued, feel taken care of, that combined care and research from birth all the way up, and that women's lives were long, were extensive, and were complex. And so this Women's Comprehensive Health and Research Center is the culmination really of several years of work, but really decades of work of interest on doctors who've been interested in women's health. So today is really the Cleveland Clinic putting a flag in the ground and saying we want to be the preeminent center for women in the world. We want to take care of women. We understand that they're not just little men, that their lives, their health spans are long and complex and complicated, and this is the place to come for your brain and for your body.
And in your research, you and doctors and some of the experts found some gaps that were really surprising in why women midlife and later were missing some of these key findings.
Well, there's huge gaps in women's health, period, end of story. The research has not been there. Women haven't been included in the same way men have been included. There's gaps in medicine we take. There's gaps in knowledge about devices for women. There's gaps all over the place, and particularly when it comes to Black and brown women. So I think that, there's also been a huge lack of attention on women at midlife. And we talk about women 40 to 60, women are taking care of parents, they're working full time, taking care of kids, and they drop off very often seeing their doctor. And then they come back in their 60s with a chronic disease or one of many chronic diseases. And so I think focusing on women at midlife, trying to understand what is going on for women at midlife, is that the place that Alzheimer's begins? Is that the place that cardiovascular deterioration begins? Is that the place that type 2 diabetes begins? And then we can help women at midlife live longer and live better, because women do, as we know, live longer, but they don't necessarily live better.
I know for you this is a passion project. Why are you so passionate about women's health?
Well, I'm a woman, first of all, and in trying to understand Alzheimer's and why women were disproportionately impacted with Alzheimer's, I discovered, there's there hadn't been research on women, and that was a health equity issue. It was a human rights issue to me. My mother struggled her whole life, and therefore my whole life, with her health, getting misinformation, not being treated like a woman, her health not being understood, and that was a scary thing to grow up with. And I also felt that, I couldn't understand Alzheimer's in women unless we understood what was happening in women, particularly at midlife, and then to see that we didn't have the research, I was like, no, we have to rectify this, and I can use my voice and my energy and my passion to make a change that will benefit women in the future.
And just last month, you were at the White House, where the president signed executive order.
Yeah, we've been at the White House several times. I mean, this president has done an incredible job, and the First Lady, first with the White House Initiative, which was last November, and then with the executive order just last month, and then certainly galvanizing the entire federal government, allocating money, hundreds of millions of dollars, saying we needed $12 billion to rectify the situation and to really focus on all that's going on with women. So it's not just women are 2/3 of those who get Alzheimer's. They're 80% of those with autoimmune. They're the majority of those with MS, and the list really goes on. 6,000 women go into menopause every single day, and so many women go to their doctors in the perimenopause or menopause stage, and they don't get the answers they need because they don't have the research. The doctors don't have the research to really be able to tell women, well, we know this, we know that, we know you should stay on hormones this long, or we know you shouldn't go on hormones, or you should go on hormones. And so that's unfair and unjust, and we're changing that, and I'm really happy and proud to be a part of that sea change. I'm happy and proud of the women's Alzheimer's movement that's been a huge part of shifting this change. When I got involved in Alzheimer's, because my dad got Alzheimer's, women weren't even in the picture. When I would go around and talk to doctors, they would say, well, you know, it's just because women live longer that you think that there are more women with Alzheimer's, and that was wrong. And so I'm really proud of the Shriver report, which changed the narrative. It put women front and center with their issues with Alzheimer's, so it put them front and center of the disease. And I think the White House initiative is putting women front and center in their health care. So often when we talk about women's health care, we talk about reproductive health and or breast cancer. And while those are two very important aspects of women's health is so much broader, so much longer. We don't talk about endometriosis. We don't talk about osteoporosis. We don't talk about depression. We don't talk about bone health, all of these things that are really critical to how we age and how we live and how we work.
Just recently on the Today Show, and just in case anybody hasn't caught it, it was eye-opening to me how you brought up that women weren't part of some of these research projects until, was it 1993?
Yes, exactly.
That was really eye-opening.
Yes, and I think it's so interesting. I travel all over the country and I talk about that, you know, that it's only until recently that women have been included in trials. It's only until recently that we've even begun to focus on women's health. It's only this president who has started a White House initiative. It's only this president who has said $12 billion needed to rectify the situation. And people are like, that's impossible. How could that be? It is. And it is something that we can change, and so we need women to vote for people who will put money into the federal budget to study women's health. We want to get researchers to know that there is actually money now at NIH where they can go and get money for their grants, for their research, because women's health can't advance unless we have the research. Women can't live healthier lives starting at a very young age unless we have the research to help them. So whether it's in their maternal health, whether it's involving endometriosis, whether it's involving menopause, perimenopause, you name it, if we get the funds, if we're able to galvanize the research, if we're able to get the information from the research, women can make informed decisions about how to live, how to age, how to work, how to live.
And starting with this research center here,
Yes.
it will have a ripple effect across this community and others for sure. As a mother and a grandmother, what do you hope for your daughters, granddaughters in the future with starting this research and really putting funding into it?
Well, to me, it's research and care, because so many women that I've spoken to over these 20-some years that I've been working in this space tell me that they have felt unseen, uncared for, invisible in the healthcare process, and I want to change that. And I think this center is a center that has the word comprehensive in its name, and we need to start looking at women's health span as a comprehensive issue, right? I mean, my daughters have different health needs than I have, right? My granddaughter has a different health journey than I will have. But I think that because of these advances, because of the White House initiative, because of the $12 billion that the president has asked for, because of a comprehensive women's health center, that didn't exist for me. And the fact that it now exists will change the trajectory of women everywhere. But we have to be mindful that many women live in places where there is no care, where there are maternal health deserts, where they can't get doctors. So while this is incredible for the women here, and there are virtual visits that are, in certain states they can have access to virtual visits, but we need to get women's health care into every state, into every country. This is a global issue. And we have to rectify this situation that this can't be an equity issue. This has to be something for all women. All the doctors here are super excited. So many women have worked in this space for decades without seeing their name on the door, without feeling that women's health was valued. I hope medical schools will change how they approach women's health, that they'll spend more time thinking about women, educating new doctors about perimenopause and menopause and issues that disproportionately impact women, and how to treat them, how to talk to them. And I hope hospitals around the country and around the world change as well.
Well, it's so exciting.
Yeah.
You're setting the pace. We appreciate it.
Thank
this is
you.
so exciting. I'm so excited to see what it does. And
it's going to do a lot. It's already, I think, this is a beginning, but there's a lot has gone into this day. A lot of really looking at what exists, how best to treat women, what are the areas that they need, whether it's sexual health, brain health, emotional health. People don't even think of brain health. Is that the same as mental health? Is that, why do we need brain health different from body health? All of these things, when I go around the country talking about it, people are like, yeah, I actually never thought about that. I didn't think about that, or I didn't think that, the medicine I'm taking wasn't tested on women, and therefore, no wonder I might be having different reactions to it than my son or my partner or whatever. So I think that, this is a, kind of revolutionary way of looking, and yet it's so revolutionary to think that it's taken this long.
At a private event that night, Maria talked about how her mom was always sick, but doctors never really figured out what was wrong. How her mother was given medication where the dosage was based on a man's size, and how she and other women don't feel seen and heard. When we come back, one doctor shares her best advice so we can all actually enjoy Mother's Day stress-free. We'll be right back. Welcome back. We are in the Mother's Day season, and even though we all have visions of peaceful brunches and happy family gatherings, that's not always the reality. So, how can we adjust expectations about what this holiday is all about? Relationship expert Dr. Jackie Del Rosario talked to me about the stress of it all and how to navigate imperfect relationships. Okay, so Mother's Day. This holiday can be very tricky. People go in having all these big expectations. How do we approach the Mother's Day weekend with the right expectations, in your opinion?
Well, I think, first of all, we need to stop idolizing it as a perfect day and instead focus on the meaning, and that's showing love and appreciation. You know, we go through all of this planning, and it really can be overwhelming and stressful. And, you know, the tricky thing that I realize as a mother myself is that I'm also a mom, but I have to celebrate my mother, and I have to celebrate my mother-in-law, and if there's a grandmother or great-grandmother as well. So you kind of feel squeezed in your approach to celebrate because it's about so many other mothers that came before you.
That is something that I think every year around this time, my friends and I are talking about. We're managing up, is what we call it. You know, it's not like we get to kick up our feet and relax. But is there something, like, do we delegate? How do we make sure that we are carving out time as mothers, but again, as the role of daughters too? How do you balance all of that? Do you delegate? Do you make it clear what you want and what you need out of that day?
Absolutely. I think you said the key word is delegating. You know, it's so heavy to go up a mountain when you're carrying a 20-pound load. But if I can divide that load amongst 3 different people, it seems a lot lighter. So I would say delegating and making it a group event so that all the weight of it doesn't really rest on your shoulders alone. It should be something that multiple people contribute to. I've even seen where different mothers that are unrelated might be celebrated together. So my best friend and I celebrated our mothers together. So we had a joint Mother's Day. So I didn't have to carry all the weight alone. So delegation is definitely it. I think the second thing is plan, plan, plan. Planning ahead is what's going to remove a lot of the stress as well and give you the opportunity to put things in place, plan things out so that you can have the day that you're expecting to create. And then lastly, I would say, be okay with putting yourself in the equation. I think you should also choose activities and events for that day that check off of some of your boxes as well so that you're not left out. We don't want you slaving in the kitchen and doing so much for so many other people that you're depleted and without on your special day as well.
And since you're an expert in relationships, I have to ask about all of those other tricky situations. Families in general are just, you know, there's always drama. I don't know any family that doesn't have some sort of drama somewhere. And even though you might have a great relationship with a mother or mother-in-law, maybe the other relationship is difficult. How do you think, what is your best advice to somebody who might have one of those strained relationships, whether it's a mother, mother-in-law, stepmother, and how it's not that perfect relationship, but you're gathered together in the same room? How do you, what's your advice for people who have those type of relationships?
Well, first of all, I want to let them know that relationships are messy. So it's not that there's anything wrong with you or them necessarily. This is what we call relationships. And so we got to get used to the fact that there's always going to be ebbs and flows, ups and downs, and there's going to be challenges. And I think that we're the better for them because they give us a set of skill sets that we build along life's journey. So the first thing I would say for those that are dealing with tricky relationships that might be a little bit strained, I would say set boundaries if necessary. Setting boundaries helps to protect your well-being so that you can feel safe and you can feel good as you're journeying in that relationship with the other person. And I know that this might be difficult for some people that might be passive aggressive or more closed with their emotions. But there's ways that you can set those boundaries that don't have to be so confrontational so that people can respect what's important to you. The second thing is, I would say, focus on positive interactions. They can be small, genuine shows of affection and care for the person. It doesn't have to be these loud shows of affection. Things that you do that lets them know that I'm here and I do care, even though we might have a lot going on in our relationship. So those are just 2 main things that I would say. I would also say, be the bigger person in the relationship. One of the things I learned with my mother-in-law is as time went on, there could be, as I mentioned, some challenges. But if I remained constant, the challenges just fell away. So instead of responding to, say, an insult or something that I took offense with, I just maintained my general behavior. I didn't now stop not, calling or stop going by because this thing occurred. I remained constant. And then I noticed that over time, those challenges really just melted away and they became fewer and fewer. So that's the advice that I would give. Hang in there. it gets better.
I like how you said focus on the little positive things, because as you also kind of just mentioned, sometimes we focus so much on all of those past negative interactions about, the slight or the thing maybe, the misunderstanding we had or the comment that maybe somebody took the wrong way. Is that the key to get over it? Like, how do we get over that and make sure that how we move forward is with forgiveness and grace?
I think that trying to show unconditional concern and care for people is really going to be paramount. If I'm offended and I'm able to understand that there's a bigger picture, I'm married to your son, or if you're my mother, it's my responsibility to be in your life and to give my kids maybe a grandmother. We're not talking about cases where there's someone that is toxic, but we're just talking about the general challenges in relationships. Mm-hmm. They're for life. And I think when you have that commitment and you have that perspective on them, you learn how to manage the little molehills so that they don't become mountains, and that they don't cheat you or rob your family out of those special bonds that you have. Relationships are everything. We rise or fall on a good one or a bad one. So I would say arm yourself with tools that help you to cultivate strong ones and good ones.
I also want to speak to the mothers out there that have either growing children or, are facing, one day, maybe very soon, having that daughter-in-law. Mm-hmm. How would you recommend, in your opinion, how do you start that relationship off on the right foot? Like, is there a key to the communication? As the mother who might be becoming the mother-in-law, or, has a teen, and you want to make sure that you don't grow up with a kid who's like, my mom's crazy, and having that strained relationship? How would you approach that?
I'd say that the mother-in-law has to be the bigger person, and they have to recognize that even though this might be your future daughter-in-law or is your daughter-in-law, it's not a given that she understands your expectations or that she's going to live up to what you think that she or he should. I think that it's an issue of communicating clearly, understanding that you have to take the lead in showing someone what it is that you would like out of them, and that's going to be done through nurturing instead of pointing a finger. Learning to be a nurturer, to love, and to groom, if I would. That's almost a funny word to use, but you're grooming them into their adulthood as a mother and as a wife. You've learned so many things along the way, but I think a lot of times, mother-in-laws come and they want this person to fit in right away, but it does take time. Not only are you melding two lives together, but you're also bringing a new member into the family, and I think that the best way to do that is in a heart of love and acceptance, and at the same time being patient, understanding it's going to take time for them to maybe step up in the areas that you might deem necessary. So I'd say be patient. I'd say be caring, and I'd say understand that it might be your role to help to get them there.
I love it. Great advice. Anything else for any of the mothers out there approaching this Mother's Day? What is your key to a happy Mother's Day?
My key to a happy Mother's Day is keeping it simple. I don't try to overanalyze anything with perfection, and I've really learned to offset my load. So those tips that I shared are really tips that I use myself. And sometimes I've learned to do several other things. So one of the things I've done, I give love coupons. These might be things that I desire to do for that person, but I might not be able to fit into Mother's Day. So I give them that coupon for them to redeem when they'd like to. So it really kind of says what I want to do with them or for them, and I give it to them to redeem. You got to remember, though, they can redeem it at will. The other thing I've done is I allow the person that I care about, because I do have women that were mentors to me that are like spiritual mothers. I let them select a day in the year that's a day that they want to spend, and I set the parameters. It might be an hour with me, or it might be 2 hours with me, or it might be a day. And they select a day in the year, so I'm able to plan ahead, and we do what they want to do for that day. And here's another good thing. Food delivery services are a dime a dozen now. Why can't you just even send them their favorite meal or something from their favorite restaurant? You can make it a lot simpler now. Technology helps us to show our love and concern and to do it without as much effort. You can even send a card electronically nowadays. And so there's so many different tools that I've put in my repertoire to help me to make Mother's Day a pleasant day and not spread myself so thin that I'm not able to enjoy it as well.
Great ideas. How great it would be if like coffee and donuts showed up in the morning on Mother's Day. I love that idea.
It doesn't have to be flowers. It can be,
Yes.
it can be donuts and coffee.
I was going to say, like, we all fall into the trap of just send flowers, but coffee and donuts? Who wouldn't love that? Thanks for joining me on Mom Squad. We'll see you right back here next time.